ventilators, and things like that. Oxygen supply does not mean only producing oxygen. You also have to have adequate number of cylinders and additional attachment like the flow meter and all. Those also need to be produced, which means that a proper governance of a pandemic includes a plan of production of the things that would be necessary to counter the pandemic. Unfortunately, we did not see anything like that happening. Even there was no governmental plan of producing and distributing masks and sanitizers. Though every time we were hearing that this need to be done, but even it was left to the market. As a result of which most poor people cannot afford these things, and naturally the virus is spreading. In order to produce these things, if there was a concrete plan of production of these things, actually scientists had suggested that these need to be produced in large numbers, and looking at the scale of the pandemic in the European countries and in the United States, which happened before us. So the experience was there for us to garner. It was possible to estimate the numbers that we will need. And there are a large number of closed factory spaces which could be used in a planned manner to produce these things. And a large number of people have been rendered jobless by the pandemic, and they could be productively utilized for this. Countering the pandemic would be a plan of utilizing all the governmental spaces that are available, all the government hospitals, health centers, everything had to be prepared, the personnel had to be trained, and all that time was there. But unfortunately, nothing to cope with the scale of the pandemic was as a result of which we are now seeing a situation where people are dying.
Please stop.
Can somebody mute? Can somebody mute?
Jahan, audio ta bond karo.
Can somebody?
Hello, somebody is noising.
Jahan,
Hello?
Jahan.
Dinesh?
Jahan, audio ta bond karo.
Dinesh, can you help in muting the person who is unmuted?
Jan, please stop.
Sir, 1 minute, sir.
Please close
Sir,
your.
wait for 1 minute, sir. Wait for 1 minute. I am telling them. Jahan, audio ta bond karo. Jahan.
এভাবে হবে না, আপনি
জাহান!
ফোন করে বলুন।
Jan,
এই তুষার ফোনটা করে বলো।
Okay, now it is switched off. Yes.
Jahan.
Now it's switched off.
No, yes.
Yes,
Yes. So the feeling is that because of that, we are now facing a situation where people are dying in droves without any medical attention. And the places where it has not reached in that dimension yet, for example, the Northeast, there also it is going to reach, and therefore it is necessary to prepare those states to counter the kind of problems that other states are facing. And in this, you can play a role in sensitizing the administration as to what needs to be done. Adequate number of hospital beds need to be prepared, even if there is no requirement right now. Adequate number of oxygen production facilities have to be created, even if there is no requirement right now. Because this is the second wave, and there will be a third, and the whole thing might continue for a longer time. It is not going to go away in a matter of months. So,
Bosirulda, what is that? আপনি জানেন না নাকি বিষয়গুলা? বসিরুলদা, আপনি জানেন না? আপনি অফ করেন না ভিডিওটা। এগুলা জানেও না।
All the participants are requested to stop your video, close your video, and mute your sound, speaker. All
Speaker and video.
Speaker and video. And also at the in the meantime, I want to inform Kamal Shai that YouTube channel is not working. 25 people waiting here. So please do something. Or Dinesh, please do something. YouTube channel is not working. Sir, please continue. Sorry for the interruption. Sir.
Okay. I mean, I do not want to speak much. All I'm saying is that in the states where the situation like in Delhi or Maharashtra is not yet, has not yet reached, you have a breathing time when the corrective actions need to be taken so that when the wave reaches, the state is prepared. And in that, the people in the Northeast now, again somebody is unmuted. Again somebody is unmuted. Okay, can I have Dinesh speak for a minute? Dinesh? Dinesh? Can you unmute yourself and say yes? Dinesh?
Sure.
Dinesh, are you online? Yes. If you are the administrator, then you can mute people who are unable to mute themselves. So please do that. This is necessary because sometimes we are getting disturbance. So the point is that there are similar various things that need to be done, not only as a person. We need to take care of ourselves, and Dr. Tarun Mandal will talk at length about that. All I want to say is that this is the time to sensitize the administration about the steps to be taken at the state level. And it is possible to counter the pandemic because there are many countries which are practically unaffected by the pandemic. We have already heard that in the newspapers. How did that happen? All they did was to take preventive action before it struck. We did have that time because it entered India after it entered Europe and America. And so we do have that time. For example, one of the things that any epidemiologist will say is that in order to counter an enemy, you have to know the enemy first. So if it is the virus that is attacking us, we have to know the virus. And the way to know is to do genomic sequencing of the affected people so that we get to know which mutants of the virus is there in the Indian soil. Unfortunately, that has been ignored for a long time. And even when we knew about this double mutant variety that is now causing havoc, we came to know about its existence in October, but no action was taken. But the rate at which the virus mutates, and that is a major matter of concern, we need to know, we need to ramp up the number of genomic sequencing, and not the same strain is affecting people in different states. It may so happen that in some northeast state, a particular variant, particular mutant may reach, and therefore you need to know, and therefore the genomic sequencing facilities have to be there. So all these, my suggestion is that you who are there in the soil, you take the initiative to sensitize the administration to take these steps, so that large number of people do not die, as it is happening in UP, in Delhi, in many other states. Dead bodies floating in the rivers. That kind of situation should not happen. Okay, with that, I will stop. And I suppose what precautions an individual can take or a hospital can take, that Dr. Tarun Mandal will be better placed to illuminate about. Thank you.
Thank you, sir. Soumitro and led us with very, very important suggestions. And next onwards, the committee will try to follow this suggestion to pressure the government to take necessary steps to save the people. So now I shall request our main speakers will talk on the topic awareness program on prevention of COVID-19 pandemic. Dr. Tarun Mandal. Already I said about Dr. Tarun Mandal. He was an ex-MP, former member of the Committee on Health and Family Welfare, Govt. of India. He's a renowned doctor and in Kolkata. Now I shall request Tarun Mandal to speak and, on the subject.
Thank you very much to the 125th Netaji birthday celebration committee, particularly of the Northeast region. I am audible, sir? Professor Ajoy Roy?
Yes, you are audible.
Yes. Thank you. I like to express my thanks for organizing such a topics of discussions this evening, on which the entire nation and perhaps the all population is very much suffering, and rather they're in a panic state. The way the number of death tolls, the infected persons are increasing day by day in India. And on the name of Netaji Subhash Chandra Bose, the great patriot of the soil, from his life struggles also, from his growing up, from its childhood, student life, youth, and participation in the freedom movement, there are records that he participated in numbers of disasters during his lifetime. He personally joined in the relief work of flood, cholera outbreaks, and famines like that in different parts of Bengal and other states also. So it is true what Professor Banerjee was telling. If this great soul would have been alive today, he definitely would come forward to extend his cooperation and help and knowledge and assistance for the benefit of the citizens of his motherland. And I particularly express my gratitude to this committee for inviting me and myself very much a part of this committee also, to give me the opportunity to discuss few aspects of this dreaded viral disease. I hope I will be able to send my basic message to you, the audience, whom also I congratulate for participating in this program today, within around 35 to 40 minutes. And after that, if any clarity requires from my talk or any question arises in your minds about any aspects of COVID virus, treatment, personal protections, isolations, testing, treatment, etc., I shall be happy to take that, definitely within the stipulated scheduled time. Let us strike it first, as a medical doctor, that it is no curse by any god or Ishwar or any demons on the people of India or the population of the world. Professor Banerjee has clearly told you that it's a virus, and it's a family of virus, corona. Its earlier varieties were already creating some milder disease within the human being. And this particular variety probably have come out through mutations from the bats, maybe from mongoose. Through their natural mutations, acquired some particular severity of infective quality to attack a human being. It is called novel, novel means new, as assured, who assert or appeared in the world anew. That was in Wuhan in 2019. And from there it spread all over the world, India witnessed its first case on 30th January at Kerala, first 2-3 cases, 2020. And after that, the history gradually, how it spread in its first wave, nearly all over the states of India, and definitely the Western European countries worst affected, along with US, America, and some more countries that doesn't require elaboration that you know. So what I like to tell it here, no prejudice, no obscurantist thoughts, no superstitions. It's a virus. As virus, bacteria, fungus, parasites, poisons, and so many other things can attack, infect, and may cause of sufferings of the people, human being, like that. It's a virus. Corona is a virus. And as because it has special category of giving sufferings and attacking our lungs, our pulmonary or respiratory system, it is called SARS-CoV-2. SARS means severe acute respiratory syndrome. Syndrome is a conglomeration of several symptoms or sometimes conglomerations of several disease. In medical knowledge, that is designated as a syndrome. So it is severe acute respiratory syndrome, and it is caused by CoV-2, coronavirus numbering 2. In medical terminology, we call it a zoonotic disease. Zoonotic means the virus or the causative agent comes in the human being from animal, birds, or from other life. It goes from man to man. It's not like that the malaria parasite, it bites a human being, takes the parasite, then infect other person, not like that. Once it entered into the human being, infected somebody, that infected person can infect others. Through which way? Through coughing, through sneezing, through spitting, by talking, by singing, by shouting, by touching. This way, I can spread or I can be infected from an already infected persons. What is the route of entry? This is very, very, very important for our personal and social protection from this virus. This three route is very fixed. As because the virus is changing, transforming, mutating, you don't think that roots is also changing. Our roots is face, oral, mouth, nose, nasal orifices, and eyes. These three roots are fixed. If we can properly and entirely stop entry through this passage, nobody will be infected, I can tell you. So you can understand now what is the value of wearing mask, a proper mask, and to wear it properly. And even by talking, even by singing, it can go. And the mode of going is usually droplet infection. What does it droplet mean? When we cough, when we sneeze, you can understand some materials from our nose or oral orifice, mouth goes out, like some minor miniature droplets of water like that, tiny particles. These are filled up with infection or virus, coronavirus, if you are already infected. So for protection of you and for protection of me, if I am infected or not infected, I do not know whether when I am talking with you, you are infected. So it is safe to wear mask both the sides. Both the sides should wear proper mask. And usually these droplets can travel at an average 6 feet, 2 meters. So this is the distance you have to maintain, what the doctors and the scientists are telling. Number 3, how we can kill the virus so that if I come in contact of it, it will not spread or it will be killed. And for that reason, it is sanitizer or soap water or bleaching powder, like those things in water. These can kill this virus. So 60 to 80%, average 70%, you know, alcohol is most lethal to kill any germ. So average 70% alcohol must be in the contents list of the sanitizer. Whatever else may be within it, but at least 60 to 80% of alcohol, ethanol, or ethyl alcohol must be there. Usually soap water is equally effective. And chlorine water, sodium hypochlorite is also equally effective. And to a good extent, hydrogen peroxide is also effective. So fumigation or cleaning of a room or hospitals are usually done with this sodium hypochlorite 1% solution or with hydrogen peroxide fumes. But for a human being, for a house, for a family, it is required sanitizers or soap water. You must keep in contact. You wash your hands time and again. Why washing hands, not other parts of the body? Because you can understand it is our normal habit to put our fingers either in the face or in the nose or in the eyes or in the head like that. Very frequently. And there is a study also by the scientists how many times a normal human being puts his fingers in the face, eyes, nose, etc. in a day. So it is a normal habit of human being. So if you have to give a touch to your face or nose or eyes, before that, you sanitize your fingers. Before that, you wash properly your hand with soap water, normal soap water. That will help your hand to get free from the contamination of any coronavirus. That I can tell you. And you must avoid gatherings. भीड़ भट्टा जो है वो आपको avoid करके चलना पड़ेगा. You have to avoid it because you can understand that you are coming in close contact with people, and if all the people are not wearing masks, etc., then you are in jeopardy, you are in danger. So to avoid it, you have to. So these are the basic medical precautions I already told you. Masking properly, and masks, usually N95 mask, the medical or surgical mask, it is called 3-layered. That is 95% can prevent your virus to enter into your body. Second is N95 or N99 mask, which is available in the market. You remember, in whatever quality or fancy model, you make your cloth, out of cloth masks that cannot prevent coronavirus. So it is dangerously ineffective, I like to tell, ineffective. You can advise to give a good look or to keep your medical mask a bit clean. You can cover with a cloth mask, but never use it singly or only cloth mask. It will not prevent corona to enter into your body. So these are the basic medical precautions. But remember, there is another route nowadays in debates. I like to throw a little light on this. Whether it can pass in air, airborne, or aerosol. What is the difference between a aerosol and a droplet? Aerosol is further smaller, further tiny than a droplet. And as droplet can travel at an average 6 feet, you remember this aerosol can travel in the air around 20-22 feet. But ultimately, if the aerosol also contains coronavirus, it will fall after 5-6 gauge or meters. So the aerosol theory, which was discarded earlier, but after so many researches from different centers of the world, the researchers and the scientists and the medical world are now accepting partially this virus is also airborne. And for that reason, when in the house also we are conglomerating or making a meeting or a family talk also, it is being advised that you please maintain proper distance, and if you stay together for more than 15 to 20 minutes, then definitely everybody should wear medical mask. But you have to remember that only singly a virus cannot infect you or can be the cause of a disease or fatality. 3 things are required. The quantity of the virus, how much number of virus have affected you. Number 2, the quality of the virus, how much ferocious it is, how much infective it is. What Dr. Banerjee was also, Professor Banerjee was telling, this double mutant strain, the present strain in India, bahut khatarnak, very dangerous, giving too much sufferings, increasing fatality, and even also after first-hand cure, it is giving post-COVID different complications up to 2-3 months. Very dangerous, and already it has spread into at least 45 to 50 nations of the world. And not only our Indian variety, even the Britain strain, even the Brazilian strain, even the South African strain, East African strains, these are also have some special qualities. Here qualities means more ferocious, more dangerous quality of the particular virus, but it is danger for the human being, people like us. So 3 things required: the quantity, how much attacking a person, and what kind of virus it was, Third, the personal immunity of the particular person. You must be knowing that not only by this virus, for any other virus or bacteria or say a parasite or say fungus, whether a person will be affected or diseased, that will depend on the quality and the quantum of the immunity of that particular person. So immunity is very important, immunity. And how can we get immunity or boost up our immunity? Yes, there are several ways. I will enumerate that for your understanding and for propagation to all. Number one, you have to take a balanced diet, which must contain some protein, some fruits regularly. If you are a vegetarian, you must take milk, you must take pulses, legumes, and also along with dahi, curds, etc. Though these are animal proteins, you know, milk and curds, etc., but it is usually known as vegetables. And who are taking non-veggies, they can take fish, eggs, meats, etc. No harm. Rather, this antigen and antibody, both are product of proteins, you must know. So if I am deficient on proteins, then I will be deficient in making immunity in my body. So this is the need of taking balanced diet. And I must hydrate myself, particularly in this summer type of weather and places, with 3 to 4 liters of fluids or water every day. For an adult person, I'm telling you. Except somebody is categorically advised not to take more water for heart disease or kidney disease or something else. Or otherwise, in India, in the summers, at an adult average, we have to take 3 to 4 liters of water or fluids or milks or some teas, etc., etc. Number two, regular some freehand exercises, breathing exercises, walking. Make it 30 to 45 minutes, everybody, regular. That will give you more immunity. I like to tell you as a medical practitioners and doctor that more people are being affected and suffering from less immunity are those who are usual with sedentary life. That means who are not related with regular physical work or exercises. So you can understand the importance of light physical exercises, walking and pranayams, breathing exercises, etc. Number four, I like to stress and tell you that your sleep, your rest, your relaxation and recreation is equally important to build immunity in our body. You can understand if you cannot get proper sleep, at an average, an adult can take 6 to 8 hours of sleep. Proper rest, relaxation, recreation, some form. Go for storybooks, go for cinemas, go for listen some songs, chat with some friends. You must be relaxed. Unnecessary anxiety for some near and dears who has been suffering, died, or might go into fatality, might be infected in that way. If you take into your own heads, और ज्यादा आपका दिमाग का अंदर आप ज्यादा चिंता लेते हो, तो आपका इम्यूनिटी का ऊपर इसका असर आएगा. Your immunity will be affected with these unnecessary thoughts, anxiety. So that must be controlled. And finally, I like to say vaccines. And these vaccines, I like to tell you, this is a part of the entire process of protecting you from the coronavirus attack. Vaccine is not the entire or the outstanding arsenal which will protect somebody who has been vaccinated, both the doses, and have passed the required time interval which will create adequate antibody in his or her body. Vaccine is an instrument it must be taken with exercises, foods, sleeps, relaxation, some essential vitamins like zinc, vitamin C, vitamin D3 in this particular case to fight COVID. And definitely with obeying very meticulously medical precautions, I tell you. Without medical precautions, nobody in the world is telling you that only by taking both the doses of vaccines will protect you. And even doing everything, you may be infected. The vaccines is not like that, like your polio or tetanus toxoids or diphtheria or mumps, rubella, measles, etc. Vaccines, after you get vaccinated, both the doses, your antibody has been prepared in the body, but still you can get infected. But that infections will be of low level, your sufferings will be less, the chances of fatality will be much less, and even the hospitalization necessity will be curtailed or will not be required in most of the cases. So there is the definite benefit of vaccines. Many of you can question, there is also some problems with vaccines. Somebody is getting side effects, somebody has died, we have got news, etc. But take it from me, worldwide reports and records is that very less number of people has been affected with the side effects of vaccines, like some blood clots, like some minimal paralysis, or some others minimal side effects like pains, body ache, fever, vomiting, some rashes, etc. This is percentile wise. In 10 lakhs, 1 person can be affected like that. So any medicines, even in the rabies, anti-rabies vaccine we take anti-influenza vaccines, the people who are over 65 years of age, anti-pneumonia vaccine, vaccines for hepatitis, vaccines for so many other diseases are available now. In each and every vaccine, you must remember that there is a possibility of side effects, not only minor, sometimes the major side effects, like sometimes in a minor medicines, with some medicines also, some serious side effects may appear in some persons, nobody knows, and can even endanger life of that particular person. But it is in science and in all probability in a very minuscule percentage in comparison to the benefits of the vaccines in general. So in that light, we have to take the vaccines. And before going into some symptomatology of this disease and other things, I like to tell few words about the testing. How could you know that, or you could prove that I have got corona, I have been affected with coronavirus? I can tell you there is no definite proof. Why I am telling it? Because the two kits we are having now, that is rapid antigen test, rapid antigen test. Its sensitivity is around 50 to 60%. इसका मतलब माने यही है जो 100 लोग का 100 लोग का आपका अगर इन्फेक्टेड हुआ है, लेकिन विथ रैट टेस्ट, रैपिड एंटीजन टेस्ट, आप ज्यादा से ज्यादा 60 आदमी को पकड़ सकते हो, बाकी 40 आदमी को आप बोल देता है जो उसको नहीं है, लेकिन उनका अंदर भी है. This is the deficiency or fallacy of the test. Equally, which is being treated as the standard test, RT-PCR, real-time PCR, polymerase chain reaction, you know. That test has also credential of detecting 75% only, not 100%. So if properly the swab is taken, properly it is maintained, properly it is carried to the laboratory, there it is properly mounted on the examination slate, and if a proper pathologist can judge it, then only the efficiency of the test is around 75%. 75%. So you can understand, it is the symptoms which is giving clue to the doctors or the clinicians to take it as a corona patient, COVID patient or not the kits or detectable methods of whether you have corona or not. So what can be the symptomatology or symptoms? You can get fever, mild. You may not get also fever. You can get cough, you may not get cough, throat pain, some sorts of sore throat, mild cough, headache, redness of eye, vertigo, body ache, heavy pains in the low back or in the upper thigh, backside, weakness, profound. You may lose the taste. You may lose the smell sensation also. You may get some dizziness. You may have blackouts also. And if you have, say, hypertension, say you have diabetes, say you have some pancreatic or liver disease, say you have some neurological disease or heart disease, anything can be affected. These are called comorbidities of a human being. And you can understand in our country and all over the world, when we are aging, particularly after 60 years of age, definitely very less or few persons are there who are disease-free. Rather, we are deposed of several kinds of diseases. Either I have hypertension or diabetes, or heart disease, or some kidney problems, or some liver problems, or some pancreas, or some asthma, bronchitis, COPD, neurological problems, insomnia, rheumatoid disease. All these are comorbidities because it actually lowers or reduces our body immunity, which we were discussing earlier. All these diseases. And for that reason, our age is a factor. If you have acquired the age of 55 or 60, or being less of age, but you have such kinds of chronic diseases, then you are more vulnerable than a healthy person or a younger person. And this, in the second wave of the disease, what we are seeing or observing all over India and also rest part of the world, that it is also infecting in larger number to children, to young people, youth. And there is a scientific equation that because normally the youth generation or young people has a strong immunity in general, so when the virus is attacking you and creating the nuisance within our body system, the youth people's immunity systems in coming out in such a huge manner to fight out the nuisance made by the coronavirus, that due to its own immunity system, a robust immunity system, it is actually not only killing the virus, but killing very many healthy organs, cells, and systems of our body. And for that reason, many of our young fellows are also dying. Not only doctors, people of all professions. In pretty young age, they are also dying. They didn't have any disease also. These are some reasons inside. I don't like to go into further detail into it. So these are the symptoms. And usually we tell that after you get a minimum symptoms or you come in contact with a person who has got COVID, you go for a test within 3 to 4 days, 3 to 5 days. This is the most rather productive time to get a coronavirus from your nasopharynx or from your oropharynx. You have seen how the sample for RT-PCR or rapid antigen test are being collected. So usually we say it, but mind it, if you test negative, but you have symptoms, it is a dictum all over the world to the medical world that when a pandemic is on the move, on the run, ferocious, then unless and until otherwise proved it as another disease, you have to count these symptoms as a part of COVID, no other thinking. So in that way, the clinicians has to go forwards and to treat them. And another point I like to station here, that most of the COVID cases are asymptomatic. Nearly it is up to 80 to 85%. That means I got infected. I mixed with so many people with my family, in the office, colleagues, with my students, say, I did not know I have got COVID. They did not know even that I have got infected with COVID. And by that time, I am healed up, I'm cured, but within this time, I have spread my infection in the community, in the people with whom we mixed. And that is the problem for which the spread is running like waves so silently. So its virulence is increasing without knowing that somebody is infected. No symptoms. When you get symptoms, suppose some fever, some headache, some sore throat, some body ache, etc., etc., we call it mild disease. And mostly these can be managed with some common medicines like paracetamol, like some Montelukast, levocetirizine, cetirizine, anti-allergic tablets, and some vitamins, definitely with vitamin C, zinc, and vitamin D3 in proper doses. And two things in the medical world, particularly in India, has admitted, and they're prescribing, that is, if doxycycline is allowed to the particular patient, doxycycline capsules or azithromycin tablet, and along with that, ivermectin 12 milligram for an adult and accordingly for the children. These are the basic medicines for fighting COVID or being used to prevent in proper dosing who are coming in contact or has a possibility of getting COVID infection, either for taking care of a relatives or nearborn patient, or for some reasons going to the hospitals, or had to travel in public traveling system, had to go in crowding places. For prevention also, these can be given under consultation of a doctor, definitely. And if somebody is infected, you mind it, 17 days is required, you get relief from the infective quality. That means once you get contact of coronavirus, you have got some symptoms. If you count it as day one, then at least 17 days you must isolate yourself either in the home or in the quarantine center or in the safe home from others to shape them to get infected from you. So 17 days is still taken as a marking point. After that, you are free. If you have some symptoms also, you are free. If you don't have any symptoms also, you are free. You can mix with your family, your friends, at least from you, nobody will be infected. And mind it, if once you are infected, some sorts of antibody is being developed in your body for at least, at an average, 3 months, you are partially protected from a newer infection. But the question is, as in the natural process to shape itself, the virus is changing its genomes, mutating. And for that reason, in a newer form, it can attack you. Maybe in the third wave or fourth wave, if it comes in future. So with vaccines, even an infected person can boost up his antibody in the body and his immunity level to prevent or to protect himself or herself from further corona infections can be boosted. So that is the role of vaccines, even on is infected on in this course of this corona waves. If somebody getting more fever, more than 5 days, 6 days, cough, continuous, not lessening, feeling too much weak, vertigo, diarrhea, loose motion, pain abdomen, particularly for children. This time pain abdomen, diarrhea, loose motion is a very common symptom. Even to the adults in the second variety. So loose motion, you don't lose it as a corona symptom. It can be also taken up, picked up as a corona symptom. So if that is the scene, then we had to give some investigations for him. But it is not for your memorizing, but I'm just telling you, like complete blood count. Number 2, the D dimer to see the coagulation factors, quality of the blood. Number 3 is CRP, C-reactive protein, to see the level of inflammation in your body. And in some more critical cases, serum ferritin, iron, a measurement, and IL-6 level, interleukin 6 level. These helps the clinicians to guide him to treat a patient, whether the patient is getting worse, getting better, or in a stable condition. Along with that, chest X-ray and HRCT, high resolution computed tomography, CT scan of chest, because earlier I told you that this particular virus has a typical propensity to catch up with lungs for the lungs particular receptors, SE2. For that receptors abundance in the lungs, pulmonary system, this virus affects lungs very much. So with the help of these aids investigations, a clinician decides whether the case can be treated in the house, should he be shifted to the hospitals, or he really needs, if the oxygen gets less, say our oxygen level with that digital pulse oximeter, normally above 95 to 99, normally it remains, except in cases of COPD cases or chronic bronchitis cases, where the normal range may be 90 to 93% also. But for normal persons, it is above 95%. If it became less or reduced to 94%, 93% for a common person who has been affected by COVID or some COVID symptoms, then he must take it seriously. It's as read it as a red alert and must inform his doctor or must present him or her to a hospital to get oxygen supplement or further better treatment. And in this course of treatment, steroids, mineralocorticoids, glucocorticoids, corticosteroids has got a definite important role. But whom to use, when to use, in what dose it is to use, and in which mode it is to be used, either through injections or through orally, that has to be decided by a practitioner, not by self-medication. The overuse of steroid is also wrong for a human body. But timely use or proper use, if not taken, sometimes we can lose a patient also. So it has got a very crucial role, but with a very crucial and important judgment when to give, with how much dose to give. Similarly, the more which are now in the black markets or not getting by many patients, like remdesivir, an antiviral being used, like more superior some immunomodulators in the name of tocilizumab, in the name of itolizumab. This is not to memorize, just to tell you. These are being used for the patients who are going to ventilations, who are going to critical care unit, and there is tremendous inside metabolic process derangement in the body of the patient, so that to modulate it or to cure it or to set the balance in the proper tract, these kinds of immunomodulator medicines are being used under the definite guidance of a very experienced clinician and critical care experts. Otherwise, non-judicious use of these Jumab kinds of medicines can also deteriorate the conditions of the patients. You remember that around 10% patients, out of that, and after that 85% of asymptomatic patients, grossly, I'm telling you, may be treated in home isolations or in the isolations in your home only. Rest, 5 to 7% of patients can need hospitalizations. And the crisis of these minimum percentage of patients, you can understand in India now that nowhere a single bed is available. Not in the ICU. Already discussed, oxygens are not available. What the wrongdoings our governments, administrations, both of the center and states have done by that time, that they could do for the betterment and for this peak of the wave situations of our citizens, but they did not do in proper time. So, and out of this 7% patients who needs a hospitalization, hospital treatment under the doctor, out of them 5 to 10% of patient needs ventilations, which is also crucial to shape their life, which is in tremendous crisis in India at the present moment. So friends, perhaps I've taken a bit more time, but in a nutshell, I could tell the basic things of corona or COVID-19 disease before you, and the major things I could tell you. The red flags or bad signals are those: continuous fever, recurrence of fever, continuous cough, profound weakness, blackouts, continuous diarrhea. These kinds of patients, and particularly oxygen saturation level lessening, they are serious patients. They need hospitalizations and proper medical care. Don't delay with them. एक दो दिन देखने के बाद ठीक हो जाएगा, ये तो मामूली चीज है, ये उनको होते ही है, ऐसा मत सोचिए. And this is very crucial. I like to tell you, in this particular second wave, the time of intervention is very important for the doctors. Even 1 hour of intervention and delay, we can lose a patient, and we are losing due to several reasons in our country, where the infrastructure, the carriage, the transport, and the knowledgeable persons is so poor and so deficient. So with these words, I like to thank you all, and I like to invite any questions if you have in mind out of my discussions, or out of this also you have in mind, and if our conductor, Professor Rai, could allow you within our stipulated time, you can definitely ask me. Thank you very much for your patient hearing and allowing me to discuss with you in this evening the deadly disease COVID and the ways and out of to tackling it in the society. Thank you.
Thank you, Dr. Tarun Mandal, for your valuable discussion, advice in this very crucial time. So again and again, thanks for you, as you have given much time for us. And I think those who joined and listened to you enriched with the knowledge. So now the question hours. So already I told the participant to write their questions so that Dinesh can organize these things so that you can answer easily. I don't know whether Dinesh has done it or not, or anyone.
Yes, I have done it. I have done it.
So Dinesh, please, first you give your what the question you collected to Dr. Tarun Mandal so that he can answer. Then anyone who want to.
Okay, I am telling some questions which sent by the viewers on YouTube and the Google Meet. First question from Farhana Yasmin.
Hello.
She asked that I have a question that what is the exact time to get the second dose of COVID vaccine? Because earlier it has said that after 4 or 3 weeks, we can go for second dose. But now it's saying that after 12 weeks. How can it be? Second question from Hillol Bhattacharya. Why after getting 2 doses of vaccines, people are infected again? Third question from Paritosh Datta, that now the question raised in my mind about the plasma therapy, which is still controversial. So please say something about the plasma therapy. Next question from Kamal Shai. He asks that if there is a symptom of catching cold or low fever, etc., but hospital facilities are not easily available, what to do? Please discuss about the effectivity of teleclinic, how it can be conducted. Then these are the questions from Google Meet. Now 2 questions from YouTube, that is, what is the rule of vaccine after COVID recovery? Next, tell something about post-COVID complications and management for disease. These are the questions.
Yes.
Yes.
Post-COVID. These are the question, till now?
Yes.
Professor Rai? Yes.
These are the questions still now.
All right. Let me one by one take it up in a very brief way. The first question of Farhana, as far as I can remember, that is regarding second dose timing schedule, particularly for Covishield. The second dose schedule for Covaxin has not been changed, That is after 4 weeks only. Sometimes some talk came out like that. It can be also taken between 4 to 6 weeks. But still again, the ICMR and the Government of India is telling to take it after 4 weeks only. So the question of the dosing change of second dose schedule is with Covishield, the AstraZeneca vaccine that is being produced by the Serum Institute of India, Punawala. Anyway, the question is, the whole thing is under evaluation in the process of research and experimentation. Somebody is telling that because India is now deficient of vaccines and there is a huge craze and cry for vaccines, so it is a way of time taking of the government. If they can rather increase the time period for the second dose, they will get much time to vaccinate even for the people for the first dose, and to wait people in the queue to get the second dose for later time. And by that time, they can produce or bring or import some vaccines from other countries so that the demands could be met. Question is, I'd like to tell you again that the whole thing is under process of evaluation. You all know that this vaccination of Covishield, and even for Covaxin, which had been produced by Bharat Biotech Limited, for both of its use, the permission DCGI, Drug Controller General of India, gave for emergency use and not for compulsion. If you wish to take, you can take it. The government is not compelling you to take, like polio virus or some other BCG virus, etc. Why? Because the entire process was in the state of evaluation. So first they told it will be taken between 4 to 6 weeks. After that, they strict it to better to take it within 6 to 8 weeks. And now they're telling it to take after 3 to 4 months, nearly 12 weeks to 16 weeks. Now they're telling, yesterday the Government of India notified. I can tell you, in Britain, there are some of our colleagues who are working over there. We had talks with them much before, around 3 months back. They told us that Covishield they are also using, but the Britain government has prolonged the time for taking the second dose. And when we were practicing it in 4 to 6 weeks interval, Britain was already giving it after 12 weeks interval. So the entire thing is the government is only doing this business to kill time or to get more time to produce vaccine. The things may not be like that only. Because after newer studies and intervals, even those who are being vaccinated, how much antibody are being produced and how long it is being able to protect you after vaccination, that is also under the process of evaluation. You never know. I do not know till today that whether a booster dose is necessary even after taking the second vaccine, because till today it has not been evaluated. Or otherwise, neither of the companies are telling that after taking the second dose, your antibody will be everlasting. You never need another booster dose or any other vaccine. That they are not claiming. So it happens. It also happened in the world earlier when such kinds of pandemics, epidemics, takes large numbers of tolls, deaths within our society, within human being. Sometimes for some drugs, some vaccines, some earlier permission to experiment or to use over the population has been done in the past also, and this time also that has been done. At the very beginning, during the first wave, when the question arises, with which quick time interval a vaccine against corona can be produced, then almost all international experts on this field categorically told, under the present context of our armory of research and technology, at least 18 months required to make a standard vaccines against any disease. And you understand that 18 months at least didn't pass in India or any other states of the world where that should have been taken to make a standard dosing practice or post implication, post giving vaccine survey, etc. That time they did not get. So when they saw that after giving 6 weeks, if we can give it after 8 weeks, they are getting more better antibody and total accumulated antibody is more, then the scientists or the researchers told it would be better that you take it after 12 weeks. And I do not know whether it is a fake news or something. In Britain, only in some newspaper or maybe some editions of Times of India, it came out that Britain has again reconciled their earlier decision and now telling to vaccinate its population, her populations more early. They are bringing down the dose schedule after 8 weeks only. I cannot confirm you. I do not know. So it is not totally hoax or not totally a false statement or some, what should I say? This is a statement out of science, not like that. This is going on experiments, knowledge, accumulation of data, etc. only throughout the world. And by analyzing those data only, this time schedule or period is being dictated or advised by the scientists or the clinicians. So to speak you frankly, to tell concretely about the second dose timing of Covishield is difficult. Definitely, it may be something between 8 weeks to 16 weeks now, the schedule. And some kinds of antibody you will get, that is sure. So out of nothing, it is something that I can tell you. And in comparison, in combination with the fast dosing, it will definitely increase your antibody level to some extent. Whether to a good extent or extreme extent or low extent, that I cannot tell today without getting data. But definitely we will be benefited. So don't be much worried about this dosing. And that kind of question to is roaming in the social media, that what kind of vaccine it is. Earlier it was said 4 weeks, after 8 weeks, 16 weeks, 12 weeks. Sometimes they can tell you take it after 6 months. Whether in everybody's immunity level, the things will be equal or same. Can it be science? I have amply explained before you how these things are happening because of the haste the scientific world did and had to do because of the enormous number of deaths. You can understand a country like America has also lost more than 5 lakhs of her sons and daughters. India already on record have lost more than 2 crores 40 lakhs. This is recorded only. Non-recorded maybe much more. So this I shall say on this point. And infection after second dose already I have discussed in during the point of taking vaccines. Yes, it can happen. Infection can be happen, but it will be less severity, less sufferings, less chance of hospitalization, less chance of fatality. But there is no guarantee with the vaccine that you will not be infected, or after infections, you will not spread infections. You will be spreading infections. So that is true. But for your safety and security, definitely, if you are vaccinated, you are a bit more stronger than a non-vaccinated one. Plasma therapy has been practically discarded by World Health Organization by that time. And the All India Institute of Medical Science study of Delhi also discarded plasma therapy, particularly in the question of life and death, whether it will prolong longevity or help to scavenge life of a person. It has got no credential or didn't add a single inch. But they have said in a restricted way, in some particular patients, that will be the best judgment of a clinician who is treating that particular patient. It can be used, but not for all. And it is not a panacea, I tell you, like that of remdesivir, that if I get a remdesivir and store it, I will be saved, or my family members will be saved. There is no dictum, and remdesivir is not such a drug as a panacea. And what question our General Secretary, Mr. Kamal Shah, asked, it is a very pertinent question, I should say. Patients with low fever, cold, etc. actually doesn't require hospitalization unless and until it is a prolonged on and it has got comorbidity along with these kinds of sufferings. Comorbidity I have already discussed: diabetes mellitus, COPD, heart disease, hypertension, kidney disease, liver disease, pancreatic disease, nervous disease, etc., etc. If you are having and you are continuously suffering with even low grade of fever, cold, etc., then you may need hospitalizations. You may need special care with some investigations and with some addition of drugs. But in most of the cases, it could be managed at home. And here, definitely telemedicines can help a lot. Telemedicines, advices of the clinicians who are engaged with day-to-day COVID management, they can amply help these kinds of patients. And I like to add it here that in COVID, even with the next question I will discuss it, mental anxiety, agony, depression, it is a tremendous problem. So telemedicines can help a lot in this core also to calm a patient, to make him or her anxiety-free, and to guide her how to deal with under this crisis. This COVID disease and coronavirus has tremendous effect on our psyche, I tell you. And the last question, which was there was another question, rule of vaccination post-COVID. Oh, acha. Let me take it first. Post-COVID vaccination. Till 2 days before, it was in India, it was accepted that at least 60 days or 2 months should pass after your recovery from COVID to get immunized or vaccinated. और अर्थात 60 दिन 2 महीना कम से कम आपको बिताना होगा आपका बीमारी खत्म होने के बाद नहीं, खत्म होने के बाद, रिकवरी होने के बाद आपको 60 days 2 महीना कम से कम बिताना होगा. After that you take vaccinations. Even you take a first one and in between you get infected with the COVID, that is the rule also. You have to take the second dose after you recover, after 60 days of your recovery. That should be the rule. But recently, these are all, I told you, these are all going on experiments, observations, data collections in different centers of the world, because it is a novel disease. The world did not know before these kinds of corona. What would be its effect? What would be its sequelae? Matlab long-term effects. So things will be changing, friends. If you are a scientific mind people, if we do not believe on superstitions, obscurantist ideas, if we like to enlighten ourselves on the anvils of science and arguments, logics, then things will be changing with more experience, more data, more researches, more applications of different procedures. So we have to be prepared for that mentally, psychologically. And this post-COVID complications, battery of post-COVID complications, starting from heart attack, starting from heart blocks, starting from brain stroke, maybe ischemic stroke, मतलब कोई clots जाके आपका supply line थोड़ा देर के लिए बंद कर दिया और artery फट गया, फट के आपको bleeding, hemorrhage कर दिया गया. ये जो CVA का कई तरीका होता है ना, cerebrovascular accident जिसको हम लोग कॉमन बातों में स्ट्रोक कहते हैं, हो सकता है. It can happen. It can give you tremendous effect on your psyche, psychosis, depression, long term. Even for severe disease, one can get clouding of its thoughts in decision making, clarity of thoughts, in calculations, in remembering things. It can affect for the time being. Usually it is gradually passing off. But at an average, up to 2 months after a sort of moderate disease suffering, everybody should be prepared to face 1 or 2 sequelae or long-term complications of COVID. I tell you, that may be some pains here, that may be some irritations there, that may be some itchings, that may be some indigestions, diarrhea, somewhere constipations, some sort of problems with your walking. Profound weakness is a very, very, very common problem. Somebody is taking 6 months, 8 months times to recover, to get equal to earlier strength, not even equal strength, something equal to earlier strength. So practically affecting all of our vital organs, this coronavirus can affect you. I can tell you, the first autopsy in India has recently happened in Ajoy Medical College Hospital of Calcutta on a patient who was a pioneer in donating human body for the experimental science. Mr. Rai was a good friend of us, a senior colleague who died out of corona this time, along with that stroke, brain stroke. His body was dissected post-mortem autopsy, and it has been seen the major cause was not stroke of his brain, almost all of his vital organs, starting from heart, liver, kidneys, pancreas, intestines, what not, lungs, every part is more or less affected. So you can understand, dear colleagues and our honorary listeners of these discussions, any organs can be affected by the coronavirus. So after primary recovery, some sort of pain you are getting, compression you are getting in the chest, some sort of cough you are again getting back, some sort of respiratory trouble you are getting, always remember it may be post-COVID complications due to multiple reasons. Talk with your doctor. He may advise or she may advise you to go for some investigations. She may show you some exercises, maybe for lungs, maybe for hearts, maybe for abdomen, maybe for gastrointestinal tract, maybe for your brain concentrations, to control your psyche, maybe of different kinds. You may need counseling also. So such kinds of complications may appear, say, up to 2 to 6 months post-COVID. And that is, in general, the recorded things published in different all acclaimed medical journals like New England Medical Journal, Lancet, etc. You can understand. So I hope these are the basic questions was put forward before me, and I could reply it for your understanding.
Dr. Tarun Mandal. Professor Ajoy, I have a personal question.
Okay. Yes.
I'm
yes.
General Awardee. I have a personal question. Would you allow me to put the question?
Yes. You ask the question to Dr. Tarun Mandal. And
Dr. Tarun Mandal.
Yes, sir. Yes, sir.
Dr. Tarun Mandal, I have listened to your entire discussion with rapt attention. You have made a very useful and a very important discussion, and it was exhaustive also on all aspects. Here, I have got a personal question to ask you.
Right,
I am a man above 80.
Right.
I have passed 80, and I have got a kind of heart disease, hypertrophic cardiomyopathy.
Right.
I have got an AICD, automatic implantable cardioverter defibrillator, implanted on my chest.
Right.
And now I'm in a dilemma. Some people are asking me to go for the vaccination, and some others are saying that if you go for vaccination, you may be affected. Well, there are some cases where we have seen, particularly in the case of our president, Mr. Ramnath Kovind, that when he was having some heart problem, when he got the vaccination, he had some blood clotting, and as a result of which he had to be hospitalized, and bypass surgery had to be done. Now, in my case, what do you suggest? Should I go for this vaccination, or I am quite okay? I have no symptoms of any COVID or anything like that. I'm quite healthy, and apart from this AICD implanted on my chest, I'm having a normal life. And what do you suggest me?
So let me tell you very briefly and frankly that question is, you keep aside the example of our president, etc. Point is whether there is a chance of infection of corona to you or not. That is the very basic questions. We cannot tell. Wherever you live today, you cannot live alone. Somebody is mixing with you, somebody is getting in contact with you, and there is a chance of getting infected. If there would have been no chance of getting infected, then I should say that there is no need to take a vaccine. But I have already told in my discussions that only vaccine cannot protect a person. Along with all other precautions and bodily exercises, food intake, etc., etc., in a totality, it can help us to protect our body from coronavirus. Point is, without vaccine or with vaccine, you will be a bit more emboldened or boosted with your immunity process with vaccine, no doubt, no doubt. But there is a question to put before you, a person, such a learned person, that trials of vaccines over 84 years are much less than the trials on 18 to 60 years of people. Gradually, in the European countries and America, the trials over 60 years of person happened. And up to 85 years of old people, the trials had happened in different parts of the world. And it has been told that people up to that age could be vaccinated. So, question is, by scientific logic and everything, as because you have got a disease, that means not only for your age, but for your disease, you have got some comorbidity and you are more susceptible than an equal age person who has not such kinds of disease. So definitely vaccine could help you boost up your immunity or to protect you from infection of coronavirus. But my final word and suggestion is that you must talk to your specific physician or cardiologist who are in charge of you, and they will particularly tell you that whether you should go for it or not. I tell you before the audience and for you also, for a general idea, scientific thoughts and thinking and the present situation. For that reason, I explain in that way. I should definitely suggest that talk with your cardiologist or physician, and his suggestion or her suggestion will be final for you. Thank you, sir.
Thank you, Dr. Tarun Mandal.
I think, Abedinda, you have got your answer. So now,
yes,
I want to say, since long time, Tarun Mandal has been speaking to us. So he may not be, I don't know whether he is in position to answer more questions. From your discussion, so far I understand that almost all the aspects of coronavirus related to the coronavirus has been discussed in elaborate. So some of the questions from the participants already answered. We are also running out of time. So if the participants and others allow me, so I want to conclude this session right now. So if any important question from any of the participants is not there, I want to convey thanks to all the participants from Manipur, Mizoram, Tripura, and Assam, and some other places who have joined here through Google Meet and also through the YouTube. I also convey my heartiest thanks to Dr. Tarun Mandal and Professor Soumitro Banerjee for their valuable time they spent for us to enlighten us in this pandemic situation. Only one point I want to propose here before the Dr. Tarun Mandal, Kamal Shai, and some other person of this Netaji birthday 150th celebration. When at present the vaccination shortage of vaccination causing the people in very much in trouble, can we not demand that the patent may be publicly announced, or the government should take initiative so that different companies may parallelly can make the vaccine and it will be available for the people in very short time. So this question of patent or the formula of the vaccine made by biotech and some other company, and they can, for the greater interest of the mankind, they open it to the other company, and government should pressurize them, request them, or also we can place the demand so that the more vaccine can be formed by the different competitors to help the people to vaccinate the large number of people in a very short time. So whatever this point, I am keeping this proposal before Tarun Mandal, before the committee, and if my question is over, and if anything to say by the Tarun Mandal in this regards.
Yes. I'm just by 2 lines. I'm telling you, sir. Professor Rai, you have raised very pertinent and very specific questions. Questions on the proposal, I should say. And the central government has got specifics act under its sleeves that the government can compel and can give rights, patent rights to multiple companies in the public sector undertakings to make and produce vaccines much in huge quantity in much shorter time, whatever time they can take. The government has act, and as vaccines are treated as an essential item under the government act, it can dictate terms to any companies about production and the patent right any sort of company. Some of our friends, the Tata Institute of Social Science, Mumbai, the Professor of Health Economics, Professor Soumitro Bose, in his article a few days back in Uttar Banga Sangvad, clearly and categorically told this very point. And your proposal, I fully support, I fully subscribe, and our committee must raise this point for the benefit of our people. That's all.
Thank you, sir. Okay, again, I am with the thanks to all the participants joined and the guest speaker and Dr. Tarun Mandal, Dr. Soumitro Banerjee, and all others who organized this, help us to organize this seminar, this discussion on the awareness program. And I think if those who attended, they will be benefited, they will convey to the others, their associate, when the pandemic situation they will face, they will advise the way that Tarun Mandal said to us. And with this, I request the participants, also them in future, if we arrange this kind of arrangement or any teleclinic and whatever may be done, all will be requested to help participate so that we can save the people as far as possible in this pandemic situation. With thanks, good night. I end or pick up this discussion here. Thanks to all of you. Good night.
Good night. Good night and thank you. Thank you very much.